Millions of children in the United States have attention deficit hyperactivity disorder, a condition which affects their lives at school, at home, and at play. ADHD has long been considered a behavioral disorder of childhood, and many experts believe children grow out of it as they reach adulthood. We now know that is not the case. Hello, I'm Dr. Russell Barkley. I'm the Director of Psychology and Professor of Psychiatry and Neurology at the University of Massachusetts Medical Center in Worcester, Massachusetts. Although ADHD is most often described as a disorder of childhood, it can, and frequently does, persist into the adult years in many affected individuals. Left untreated, adults who have the disorder often face additional problems beyond the core symptoms of ADHD. Problems such as antisocial behavior, substance abuse, depression, and occupational and interpersonal problems. In this program, we are going to describe the nature of attention deficit hyperactivity disorder in adults, discuss methods for making a diagnosis, and present a number of treatment strategies that have proven to be successful in helping adults cope with this troubling disorder.
What are you going to do after school today, when you come home?
Homework.
Okay. And who's going to help you with your homework?
You?
No, I'm going to be at work.
Dad?
A little bit, I'll help you.
Okay.
Brian and Peggy are the parents of Michael, an 8-year-old recently diagnosed with ADHD. Getting Michael to do his schoolwork is difficult, but Brian knows what the consequences can be, because school was not Brian's favorite place to be.
I missed quite a bit of school, not a whole heck of a lot, but enough school where, I guess I really wish that I had a direction or a focus in life where someone did take me, okay, then and say, you got to study, you got to stay with school, okay?
Got any homework?
Pat's life, by her own admission, has been a chaotic, unstructured existence.
Just about anything that has a deadline on it is it's overwhelming to me. Time escapes me, and I'm unable ever to effectively manage that. So it's hard for me to plan and have realistic goals and timetables.
And then I filed a motion for ex parte hearing to restore his license.
Steve struggled with academics his entire life. Although he managed to complete law school, his ADHD-related problems continue to affect his work.
And I just had to put in more time. I had to spend probably 10 times more time than the average person did, so that if I had a couple of cases on a Monday morning, which would be normal, I would be in here Saturday and Sunday planning out what I had to do.
These 3 adults represent thousands, if not millions of others whose ADHD was never diagnosed early in life. But Brian, Pat, and Steve are more fortunate than most. The source of their difficulties, as children and as adults, finally has been identified. Attention deficit hyperactivity disorder is characterized by a significant inability to sustain attention and effort, by highly impulsive behavior, and by an inappropriate level of activity.
Hi, Judy. Is this all done now?
All set.
Individuals with ADHD have considerable trouble in school as children and at work as adults, and in managing the daily responsibilities of life.
Come on, Richie.
ADHD in adulthood can have a negative impact on relationships, careers, and self-esteem. Once recognized and treated, however, many adults with ADHD, like Brian, Pat, and Steve, can learn to cope with this difficult disorder.
As far as my direction in life, didn't happen until 15, 16 years ago when I met Peggy. That was the turning point in my life. Thank God for Peggy's patience and understanding to talk, okay? And for me, it made my life very easy because I can talk to her about anything and everything.
It was beautiful. I know the article in the paper. I have a lifetime of ideas that never developed. Yeah. Now I have half of a lifetime left which I want to see those ideas fully develop and carried out. And I think I have the tools there now. It's not that it's easier, but I do have the tools.
It is not uncommon for anyone to occasionally have trouble paying attention, controlling their impulses, or feeling overactive. But in people with ADHD, these problems occur far more frequently and often have serious consequences.
Should we start getting ready for school? Okay. All right.
When Michael began having behavior problems in kindergarten, Brian began to see the similarities with his own childhood. What he remembers most vividly were his difficulties in school.
You stereotype yourself as being stupid, and it's very easy to do that because you find you do fall behind in class, okay, because you are distracted. There's other things. A pencil drop, all your concentration is gone and you're off on something else. And it's hard to getting back into it. Like I said, in a sense, staying focused on what's going on. Like I said, school was not my favorite place to be. Looks like it's going to start sprinkling out.
Probably.
As a result, Brian didn't spend too much time in the classroom. Rather, he spent a lot of time on the streets.
I went through numerous grammar schools due to the fact that I was just labeled a discipline problem. I associated with maybe a dozen friends. They could call it a gang today, but it was just a dozen friends that we would get together and play ball and stuff like that there. And the friends that I had then, of the dozen, we had a reunion about maybe 5 years ago now. And out of the 12 kids that I did hang around with, not constantly, but of friends, 8 were in jail, and 4 of us seemed to have made something of our lives.
Steve's difficulties developed into a severe lack of self-esteem, a belief that didn't end until he found out what was causing his problems.
When I was very young, I'm pretty sure I was very hyperactive. They just thought you're just being a kid. As I got older, they thought I was stupid and dumb. I always knew there was something the matter with me. I mean, because I always had to act differently than most of my friends did in order to get through college and law school.
Like many people with ADHD, Steve not only had academic problems, but interpersonal ones as well.
I couldn't maintain relationships. I was different. You know, I was moody at times. It took a lot out of you to have to study for an exam. I mean, it wasn't pleasant. I mean, if I really tried to apply myself, it just took a lot out of you. It just drained you mentally.
There he is. Come here. See him? Can you reach it that far? Can you see where he is?
Pat also experienced serious problems with school, problems which persisted into her adult years.
I can remember 3rd grade, my mother going in, and the comments to the teachers were, just keep her busy. Had a real hard time staying in school. I had her, even though I could pass and I was articulate and stuff, I could never pass English, things like this, but I liked going off and looking, catching butterflies, doing that kind of thing was always enjoyable. And then as an adult, that many of the things that I felt I was capable of doing, I was in fact not getting the whole thing done.
Pat's son Richie also has ADHD, although it may be difficult to tell from the way he perseveres at this computer game.
Oh, man.
Because the rules are simple and the rewards immediate, activities like computer games or catching butterflies can hold the attention of people with ADHD longer than one might expect. More telling of the disorder, however, is the inability to sustain attention in activities that don't have such immediate results. Activities like managing the daily responsibilities of life.
Okay, one side is organized, the other side is, this is the truer part of the inner person who exists within this framework here. I think I came up, I had some books, and then I was going to go tag sailing, so I got the map, and I was going to hem something, and my husband needed to get to the plumbing in the closet, so I had to pull the closet out, and I never managed to get any of it back together. So I can tell you who's going to be at Chaddock Greenfield tonight. I think it's, Dr. Hallowell is going to be up there this evening on adult ADD issues, which I really should go and see, because that might help me in the the structured bit. I have all my paperwork here for my son's schooling kind of organized in this stack, and I haven't been sewing for a few years, but I got all my fabric around here. Haven't had time for that. I've been trying to get to my exercise bike. Oh.
For most people with ADHD, life is much like Pat's room, poorly organized and highly random. But Pat, like Steve and Brian, feels a sense of relief that the source of her problems has finally been identified.
Yeah, that's even better now. The diagnosis means, you know, you can manage something or you can't, but you're going to acknowledge something here. It's not as shapeless.
It was sort of like a relief when I found out about it, because then I confirmed, you know, my suspicions, and then I knew what the problem was.
I couldn't believe that some of the things that he had done. You know, how could someone go through 6 different elementary schools? So that's when it all came together, I thought, wow, you know, there was a reason for this behavior. There was a reason.
For more than 100 years, scientists have been trying to determine what causes the variety of symptoms that are typical of ADHD. Fortunately, we now know more about the origin of the disorder, and with a greater degree of certainty than ever before. ADHD seems to be the result of a neurological defect in the areas of the brain where the ability to control impulses, delay gratification, and focus attention are located. Recent studies measuring blood flow in the brains of people with ADHD have found a reduced flow to these areas. But ADHD is not caused by diminished blood flow. Rather, it is a lower level of brain activity in these areas which results in less blood being needed. Other scientists have also shown that people with ADHD display less electrical activity in these regions of the brain.
Okay, just close your eyes.
But perhaps the most dramatic evidence that ADHD is a neurological problem comes from a recent study by Dr. Alan Zemetkin and his colleagues at the National Institute of Mental Health.
Take your earphones on, and in a few minutes you'll be hearing some tones.
The study measured the brain activity of adults with ADHD using a PET scan. In these exams, a radioactive contrast dye is first injected. Then, the person is asked to respond to a series of audio tones by pressing a button. This requires focusing attention on the tasks of listening and pressing the button.
We're all done with that part now, Mrs. Colvin. I'm going to take your earphones off, and I'm going to take your eye patches off, and then we're going to go ahead and take some pictures of your brain metabolism. There you go.
The PET scan records images of the brain, including the areas known to be associated with attention. Dr. Zemetkin explains the value of this technique.
We have known for years that particular parts of the brain are involved in attention and motor control. For example, the frontal lobes, which are up here, are areas that have been known for many years to be involved in attention, as opposed to the posterior frontal areas and motor cortex over here that's important for motor control and fine movement. The areas of red are areas of high metabolism, where the brain is working very hard to pay attention to the tones, whereas the areas of blue and purple are areas of much lower metabolism. And by knowing where to look, where in fact attention is located in brain metabolism, then we can look at particular patient groups to see whether or not the patient groups can activate that part of the brain important for attention.
Dr. Zemetkin's study showed that people with ADHD, when compared to people who do not have the disorder, demonstrate reduced metabolic activity in the areas of the brain where attention, impulsivity, and motor control are managed. This study strongly indicates that the symptoms associated with ADHD are, in fact, neurological in origin. ADHD is a psychological disorder which has many behavioral manifestations. These behaviors can have a significant impact on a person's self-esteem as well as his or her interpersonal relationships.
We're always running late. Let's go. All of their life is on a schedule. I cannot master it. It's, you know, trying to get them out, trying to get them in school, trying to get these things. You know, I never do anything the same way. I innately lack that structure. He innately lacks that structure. It's very, very hard because there's so many things that just have to be done. The cat's in a rhubarb. Cat's in a rhubarb. And yet that's how the world functions. You realize that this thing that your child's experiencing, and you're supposed to be setting up all these charts, are the same things you need, and there's a tremendous resistance. I mean, I never had a watch, I never had a calendar, I never had any of those things, which are natural tools to get through things. So for us, my husband had bought me this one a year ago or so, a wonderful calendar. It was the first time I knew next week what I was going to do. And I, in fact, did it because I was reminded that that little blockhead that time, you know, I'm always surprised it's spring. I'm always surprised it's Monday.
As Pat indicated, her ADHD is something that not only impacts her relationship with her son Richie, but with her husband as well.
Marriages aren't fair, they just are, you know what I mean? And I think he has an extra burden of trying to make this kind of thing manageable with getting Richie to comply and respond to a schedule, and also me on top of that. And we are a destructive force. The both of us are really formidable in terms of losing that schedule, losing that, you know, we bring chaos wherever we travel. You know, we had a cat, we got rid of that. It was one more ADD individual as far as my husband was concerned.
ADHD also had an impact on Brian and Peggy's relationship, but like Pat, they were able to work through it over time.
We discussed everything, and that's how we really became, to really know each other, was to discuss it and talk about everything in our lives. And it made my life very, I shouldn't say easy, but it made my life very nice.
What does Dad do?
Work.
Work? And what else does he do? What happens when you don't do your homework? What's Dad going to say to you today?
Ah!
Huh?
Brian's very verbal, you know. He doesn't hold much back, which was very hard for me in the beginning, you know. He will say his piece to anybody, to anything. I think I'm a little more reserved. And I think you find this with people that have attention deficit. They're very verbal.
Right or wrong.
Right or wrong, that's right. Whether they feel they're, whatever they do, they're going to say it. And that's it. See it with Michael. So when we were first married, you know, Brian would be saying his piece, you know, and I'd be going, whoa, you know. I said, do you have to say that? And it was after, like you said, a period of understanding. And I think that's what you have to do. And I think the key to a very good relationship with or without attention deficit is, number one, communication. Number two, we're very good friends. And I think that's important. I think that's why we'll be able to help Michael through. We work together.
He was pretty.
Hello?
People with ADHD often have difficulties in their relationships with others.
I wanted to get together with you.
This is because they say and do things on impulse which may offend, hurt, or drive others away, and they often do not follow through on their promises. These social problems may lead them to develop poor self-images.
It was like all of my life I was putting myself down because I always thought I was stupid or I didn't get things the first time around. But now I know what the problem is, you know? Like, I'd have to read something and I'd say, 5 minutes later, what did I read? And I can't remember what I read.
Steve finally did complete law school, but it took a great deal of effort, an effort he has to make every day just to keep up in his profession.
Everything is still difficult. I take my notes, and I still have to work harder and longer, but now I understand what the problem is, and it doesn't mean that I'm dumb, and I can take a certain amount of satisfaction that I went through college and all that. But now I know what the problem is, and that's what I'm thankful for.
As you have seen and heard, ADHD individuals experience a wide range of difficulties in their working and social environments, problems that are sometimes difficult for others to comprehend. Recently, I developed a new theory about ADHD, which I think helps to better explain the nature and types of problems people with ADHD experience in their daily lives. This theory states that people with ADHD are likely to have problems with 4 important mental abilities because they cannot inhibit their initial response to a situation. People with ADHD have difficulty with hindsight and forethought. They have problems separating the emotional aspects of a situation from the informational content. They are less able to use internal language or thoughts to guide their behaviors. And they have difficulty analyzing problem situations and breaking them down into component parts. As a result, they are not able to recombine them to come up with more creative solutions to these problems. The inability to use these cognitive processes prevents a person with ADHD from withholding a reaction to a given situation. In other words, there is little or no delay between an event and their response to it. Individuals with ADHD have a higher risk of having a number of other difficulties beyond the core symptoms. Approximately 25% display a persistent pattern of antisocial behavior. Between 12 and 30% are likely to have a substance abuse disorder involving alcohol or drugs. While ADHD adults are often employed full-time, they are likely to have lower job status than others, change jobs more often, are less likely to get along with coworkers, and are more likely to quit their jobs or to be laid off. Many people with ADHD continue to have symptoms of their disorder into adulthood. But it is quite possible to make a satisfactory adult adjustment. The first step is to obtain an accurate diagnosis. How is ADHD diagnosed in adults? Initially, many adults will report symptoms, often after their own children have been diagnosed with the disorder. Follow-up interviews with family members may reveal further evidence of ADHD. Finally, this anecdotal information can be supplemented with a series of psychological tests. At the University of Massachusetts Medical Center Adult ADHD Clinic, a specific protocol has been developed to help determine if a person has the disorder. Dr. Kevin Murphy is the clinic director.
Okay, John, I'd like to start by just giving you kind of a quick game plan about what we're going to be doing this afternoon. And basically what we're going to be doing is a lot of talking. Okay, I'm going to ask you lots of questions about your past and present functioning in different areas of your life. All right? That's going to be followed up with some testing, which is relatively brief. And following the testing, we will then have a feedback session where I will discuss my impressions with you diagnostically, whether or not I think you have attention deficit disorder or not, and why, any coexisting problems you might have.
While there are established procedures for evaluating children, diagnosing adults requires different methods.
I think it's important to realize that for clinicians who might be trying to determine whether or not ADHD is the proper diagnosis, it's something that manifests itself from early on. Okay, this is not a disorder that has an adult onset. We have to try to establish the existence of the symptoms of this disorder technically before age 7. And of course that's easier said than done. First, what are some of the symptoms that you've had that make you think you might have attention deficit disorder?
I've noticed a definite inability to concentrate for longer periods of time. Very short time I can do it. I've had to struggle very definitely at finishing things. And as we talked about,
John recently came to the clinic complaining of ADHD-like symptoms.
I want to run to starting a new project or starting something different, and then it loses its interest, and then I go on to something else.
So you just kind of get sidetracked a little bit.
Easily sidetracked.
It's not an exact science, and it's not as much of a science as it is with children, where we do have better assessment instruments that have established norms and percentiles and that kind of a thing. So with adults, what we generally do is three different things. We have rating scales and questionnaires that we send out to the adult patient, asking them to fill out questionnaires based on the core symptoms of the disorder, their work history, their school history. We ask also the patient's spouse to fill out some questionnaires to get their perspective on the symptoms and the behaviors of the adult. And if the parent of the patient is available, one of the parents or both, we also send questionnaires and rating scales to them. So ideally we have paper and pencil questionnaire kinds of rating scales from 3 different sources. patient, the spouse, and the parent. And that's important to get multiple sources of information. Then we bring the patient into the clinic and do about a 3-hour evaluation, both for the ADHD type of symptoms and the coexisting problems that are often associated with ADHD. Any other ways it's manifesting itself in your social life or your family life?
Well, there's always been the feeling of, what's wrong with me, doctor? If you can't concentrate, you go to a psychiatrist or a psychotherapist and you work on certain emotions, but it's still there. I have the feeling.
We look more in depth at school history and work history and psychological history, past psychiatric functioning history, medication history, those kinds of things. And then we do some testing in the clinic. All right, John, this is a test I told you about earlier that measures your ability to pay attention, okay? What I'm going to do, it's going to flash basically 2 pictures on the screen. One of them is a target stimuli and one is a non-target stimuli. And basically the goal for you is when you see the target stimuli, all right, as soon as you see it, I want you to press this clicker right here, this little button, as fast as you can.
There are tests for evaluating attention skills. This is the test of variables of attention, or TOVA. The person watches the computer screen and responds to a target image, in this case, a yellow square with a smaller black square in the upper half. Other tests are used to measure intellectual ability or to screen for any coexisting conditions, such as learning disabilities. All this data is then compiled and evaluated to determine if the person meets the diagnostic criteria for ADHD.
And then we do a feedback session where we try to begin the process of education with the patient and let them know if we think they have the disorder, why we think they have the disorder, give them a rationale for why we're diagnosing them with that, and then spend a few minutes telling them what attention deficit disorder is. All right, John, now I'm ready to kind of give you the feedback. You've been through a lot this afternoon, and I want to kind of put it all together and give you my impressions about what I'm thinking, okay? The way I do that is I first talk diagnostically about what I think is going on diagnostically, and then I'll follow it up with some specific recommendations which I think might be helpful for you, okay? First of all, as to the question of whether or not you have ADHD, I clearly think that you do meet criteria for attention deficit disorder. And the reason that I say that is the following. There's a few reasons. Number one is you've endorsed many of the core symptoms of the disorder, okay? Talking about the distractibility that you told me about, the inability to focus and concentrate, the going from one thing to another, the hyperactivity that you had, when you were younger. And a lot of the core symptoms like that we talked about earlier have clearly been there. The second reason that I think you have the disorder is that we've established like an early onset, all right? This is ADHD in adults, by definition, is something that doesn't have an onset in adulthood. And you've asked me, when I asked you the question about when these symptoms began for you, you pretty much told me that they've been there from the beginning. And that's one of the criteria we have to try to establish, an early onset, in order to get the diagnosis as an adult. So clearly these things have been going on from the get-go for you early on. And the other reason that I think you have ADHD is that there's you don't seem to have any other coexisting or competing condition that would account for the symptoms of ADHD. They often have felt that they're just inadequate, inept, dumb, lazy, unmotivated, stupid people sometimes, and those are the messages they've gotten across their lives, which has been very unfortunate. And we look at this and we try to tell them that this is not a disorder of a bad character or bad parenting or laziness or stupidity. It is a neurological condition, and part of the problem that they've had over all their lives is not their fault, and that there is treatment for this, and that we can help them to cope with the symptoms. And that idea of empowering them to believe that if they want to work hard at this, that they can make a difference in their lives and turn their lives around. And in many cases, that's very true.
It is important to point out that there are a number of conditions which may emulate ADHD in adults and which must be ruled out before a definitive diagnosis of ADHD can be made. These include manic depression, borderline personality disorder, and psychosis or schizophrenia. In addition, there are other disorders which may present along with attention deficit hyperactivity disorder and which must be addressed as well. These include antisocial personality disorder, substance abuse, depression, learning disabilities, and anxiety disorders. Because the symptoms of ADHD are so diverse and persistent, a number of treatments are used to help manage the disorder. These are medication, education, and counseling. Keep in mind, these treatments should be used in combination over long periods of time to be most effective. There are several types of medications which have been prescribed to treat ADHD symptoms: stimulants, certain antidepressants, and the antihypertensive drug clonidine. Of these, stimulants are the preferred choice. The most commonly prescribed stimulants are Ritalin, Dexedrine, and Cylert. Stimulants are fast-acting, producing effects within 30 to 45 minutes and peaking within 2 to 4 hours. Because the effects quickly dissipate, they are taken 2 or 3 times a day. Stimulants improve attention, reduce impulsive behavior, and control excessive activity. But the effects of stimulants are highly individual, with people experiencing different responses with varying doses. In addition to medications, there are several other important interventions which are used in the treatment of adults with ADHD. These include psychoeducational counseling to inform the person about the nature and causes of ADHD. Vocational assessments and guidance are used to match personal skills with work requirements. Teaching skills, such as organizational management and time management, help the person compensate for their deficits. Support groups and individual therapy are employed to deal with negative feelings from childhood. And marital and family therapy may assist family members in coping with ADHD spouses and relatives. But perhaps the most effective treatment component is receiving the diagnosis itself. This often provides a powerful insight into years of failure and frustration, as well as a dramatic sense of relief at finally knowing what has been wrong. No one has yet found a true cure for ADHD, but educational and behavioral strategies, combined with medication, have enabled many people to compensate for the deficits caused by this disorder. For example, Steve is able to be more productive.
Now, you know, I couldn't do this before. I mean, I really wouldn't have this patience to do this at this hour. I mean, I'm relatively not frustrated after being up and just constantly working and doing this reading and stuff like that. I still get up at 4 o'clock in the morning. I still have to put in the time. And whereas maybe you could read something and get it the first time around, I can't do that. But I was always down on myself. The difference was people were telling me I was stupid. And I was telling myself that I was stupid. And now I don't do that anymore.
Pat is better able to understand and help her son, Richie.
Richie has attention deficit disorder. He's hyperactive. He also has learning disabilities. But he also has a sense of that's also who he is. It is simply something he has to work with. Today is that peace day, right? No violence, no pushing, no kicking. We have been able to really work with his issues of self-esteem and learning how to phrase and praise and give him real small successes that wouldn't be there otherwise. So I mean, what it meant for him and what it means for us is learning what we need to learn, him responding to those kinds of things, because there's a different approach indeed to what will make him a healthy adult. And it also meant whatever I believed in was possible for my child, I could also believe was possible for me, which means I can do it.
And after 15 years, Brian has nearly completed renovations on his house.
It was a nursing home, and it was neglected. There hadn't been any work done for 15 to 17 years on the house. This building here, a carriage house, was condemned, so we decided to start on this first so we can make a workshop out of it. It took about a year and a half to get it where we could actually make it presentable. And after that, we started working on the main house. And then with the main house, there was so much rot and deterioration over the years. We had to tear everything down. Staying busy with the hands is probably what was really helped me out a lot. I've learned in doing it to take each job as a job in itself, and instead of trying to look at the overall picture, the big picture, and saying, you know, I'll never be finished with it. And I kind of concluded I'd never be finished with it. A maintenance man would be nice instead of a contractor, but each job in itself. And that's, like I said, where I got my direction and focus. A lot of help from Peggy in saying, let's start one thing and try to finish one thing, which I'm doing now. I'm just trying to get into the point where in life where I can really start something and finish it completely.
These patients have often come in and feeling very defeated, very negative, and we can turn that process around by giving them a framework to view this from. If we can light that fire and open up that world to them, saying, you know, there is hope, and with the proper treatment in terms of education, medication, behavioral kinds of strategies, and hard work, and support system, and manipulating the environment around them, matching them to a good job, talking about how they can manage their organizational problems and their lack of structure, and trying to increase those kinds of things in their lives, we can really make a significant impact on their day-to-day functioning.
ADHD is a psychological disorder which has many behavioral manifestations. But the most important aspect of ADHD in adults is that it be recognized as a real disorder. With an accurate diagnosis and effective treatment, it is very possible for adults with ADHD to lead successful and fulfilling lives.